Hello, my name is Rebecca Harper, and this is my presentation on communication and the health belief model. Per the CDC, health communication is a method of informing and motivating individuals and populations to improve their health outcomes through health information. This information can come from ad campaigns on the TV or in magazines, on billboards. It can also come from healthcare providers, healthcare professionals, their neighbors, friends, and family. The health belief model predicts that individuals are more likely to take preventive action under the following conditions. If they believe they are susceptible to a specific health problem, then it is perceived susceptibility. If they believe the health condition will lead to potentially serious consequences, this is perceived severity. If they believe that a course of action available will be beneficial in either reducing their susceptibility to or the severity of a condition, then this is the perceived benefits. If they believe that the anticipated barriers or costs of taking an action do not outweigh the benefits, this is a perceived barrier. The cues to action can be personal or social events that signal importance of taking an action, such as they see a neighbor become ill with a particular disease, or they see an ad on the television stating that they should get some form of testing. Self-efficacy is the person's confidence in their ability to perform and sustain this behavior with little or no help from others. The health belief model was originally designed to explain why people did not participate in programs that could help diagnose or prevent diseases. They found that behavioral change may occur as a result of a change in variables. This model is used to understand behaviors. It focused on perceived threats and the expected outcomes. In an article by Yu, Kwan, and Pfeiffer titled Influence of Communication on Colorectal Cancer Screening, Revisiting the Health Belief Model, the authors talk about a study looking at how communication factors such as media and interpersonal interaction will influence people to get colorectal cancer screening. They used persons that had participated in the Health Information National Trend Survey, or HINTS, study. They selected persons that had had colorectal screening through hemocult slides, or stool sample specimens. The study design was a secondary analysis where they randomly called persons in the HINTS study that had had the stool sample test. Persons that answered the phone were asked to take part in a telephone questionnaire. They were asked whether or not a family or neighbor or friend had been diagnosed with colorectal cancer. They were asked if they read health magazines or read the health sections in magazines, or if they watched health segments on the news, or if they searched for specific information through media. This diagram demonstrates the results of the study, and it is a structural equation modeling. It shows the relationships between the factors. It was found that there is a direct relationship between both the perceived threat of cancer and positive expectations of testing to getting the colorectal cancer screening. The study did not demonstrate a direct link between mass media and the colorectal cancer testing. There was, however, a link between the mass media and the perceived threat, and the mass media and the positive expectations. So there was an indirect influence on stool blood testing. The authors noted that on the internet, if one performed a search on colorectal cancer, half of the links were commercially oriented. They contained information on goods or private health services that were being sold. The rest of the information had information on colorectal cancer, but only 1% of it was from healthcare professionals. They felt that the limitations of the study were that it was performed on secondary data, and also that it was performed on stool sample testing and not other forms of colorectal cancer testing, such as colonoscopies or flexible sigmoidoscopies. Their conclusion was that mass media and interpersonal communication had a positive influence on the perceived threat for colorectal cancer, causing people to want to be tested. They also felt that the health belief model was a good choice and could be used for this analysis. These pictures demonstrate ad campaigns from the CDC trying to promote testing. Katie Couric's husband had died from colorectal cancer. And also, interpersonal relationships can be just family or friends talking about it, or your healthcare provider discussing it with you and causing you to decide to be tested. Thank you very much for your time. These are my references. If anybody has any questions, they can post them under my discussion board link. Thank you very much.